Our next speaker, it's a great privilege to have the Deputy Minister of Health from Vietnam, Professor Pham, with us this afternoon. And he'll be telling us about some of the challenges in his country. So over to Professor Pham.
Good afternoon, everybody, ladies and gentlemen. First of all, I would like to say thank you very much for organizer and especially Professor Alain Delaney for inviting me to attend this very important congress. I am very interested in this field. So this time I also have chance to talk something about Vietnam. So our presentation have 5 key. First, about overview Vietnam health system, and the second, achievement, and the third, about shortcomings and challenges, and the fourth is the key mission, and the last is health infrastructure. So, you know, Vietnam, we have a S-shaped and very long country. We have about 2,000 kilometer coast, and we have a lot of the very beautiful seaside with about 332,000 square kilometer, ranking 65. And for population, we have now 90 million, and GDP per capita 2,000. We are just starting the low and middle income country. For health indicator, we are very proud because compared to the country with a similar to GDP, but we achieved the very good health indicator. For example, life expectancies at birth about 73, and infant mortality, and also the under 5 mortality, and maternal mortality rate too low compared to other countries with same GDP income. For the health system hierarchy, so we have 4 levels, actually 3, for the national and province, district, and commune. For commune and district is primary care, and we think it is very important. Yeah, for us. And besides that, the government also encourage the private sector development. Well, we have now the 183 private hospitals and 35,000 private clinics. And in outpatient care, the 60% is a private sector can serve, and public only for 40%. However, in patient care, mainly the public 96%, for private hospital in charge for only 4%. So now the government still want to encourage and the private hospital development. For health financing in Vietnam, through the recently, the 10 years, we achieved very good, significant public spending. As, for example, from 2005, only more than 25% is the public expenditure. But now it's 51%. But we think it is still a challenge for us because our pocket a person household still high, 49%. And the government also developed the health insurance policy. From 1993, first time we introduced health insurance. And the health insurance law came out 2008. And this year, the Congress also approved the revised law, health insurance law, with some new very important keys. It is every citizen of Vietnam meets the compulsory participate health insurance, and also the participate by household-based enrollment. And the health insurance coverage increased from the 2006 only 42%. Now, 70% by the year 2014, and 6 months of this year is the 71.6%. And we also proud because we build the health network very widely, and the health system from the national level down to grassroots level has been strengthened. The population-based health system and preventive system have widely developed, and primary health care, preventive care with the communicable disease control have been accelerated. Every citizen has access to quality essential health service. The hospital network has been upgraded over time. The quality of medical service has been increasingly improved. A large variety of high-tech services have been extensively introduced. For health financing, we increase the state budget for health, average 10% per year for total health expenditure. Strive to achieve universal health insurance, 71.6% covered by health insurance. Implement health policy for vulnerable groups, the poor, near poor, and ethnic minority group. Implement social mobilization, PPP, etc., to mobilize more resources for health. Hospital autonomy policy is stimulated to increase efficiency, effectiveness. For health investment, we also invest for building for hospital and infrastructure of the health facility. But we still have a lot of challenge and difficulty. First, increasing public needs for medical care and change of disease pattern, a growing non-communicable disease, injuries. Infectious disease continue to put pressure on health system, especially for emerging disease. Large gap in health status between region and area of the country and different population. Health service provision unbalance between level of care, primary health care versus secondary and tertiary care. Overloading hospital for higher level hospital. Here now is the critical issue. The social society and the government and the people complain about the situation of overloading. For health financing, how to increase the efficiency and effectiveness of resources include the medical equipment, drug, finance, etc. Budget allocation and implement the health technology assessment and payment method, because now mainly about the fee for service. Health insurance coverage remains at low pace. Health resource deficiency both in quantity and quality, and irrational allocation of resources among different areas and service category. Now we suffer from double burden of disease, requirement for health system, because in the past, from 1990, we are mainly about the communicable disease, but now more than 70% is the non-communicable disease. So we need to change our system. Especially according to the WHO and the World Bank estimate and awareness about the aging in Vietnam, we will suffer from this situation from 2017 until 2030. The speed of increasing the number of elderly in Vietnam with the highest speed compared to other countries. For the key mission, first, we need to strengthen grassroots health facility, reform primary health care, both for physical facility, equipment, human resource. We also launching the family medicine integrate to the primary health care in the community health station. And for service provision, how manage the management by the NCDs, expansion of medical service, and for referral mechanism, we how to keep the pyramid shape organization, because the mainly requirement and the need of people is from grassroots level, about the 70%. It means from district to down to the community health station. But now the people jump up to the specialized hospital and also the central hospital. So we need to keep. And we also reorganize about the concept, both the concept and thinking about the community health station. Because in the past, the community health station is the lowest level. But now we move to the community health station become the center, a coordination, and the hub can connect to other. Yeah? And the special hospital and another service can support to the community health station. And the second, to implement both the short-term and long-term solution to reduce overloading in the hospital. Expand and build new hospitals in some overcrowding area. Oncology, cardiology, trauma, obstetrics, pediatrics, etc. Develop satellite hospital to transfer clinical technique to lower levels. Reform PSC health facility, transcend grassroots health facility. Third, reform health financing. Increase public spending for health, renovate budget allocation toward performance and output-based approach. Renovate the payment method. We now pilot for DRG and capitation method. Expand financial support for vulnerable group, the poor, ethnic minority. And the fourth, improving health workforce quality, meeting basic needs over time for health human resource at various levels. Community health center to be manned by doctor. Making human resource distribution increasingly equitable and rational among different regions and areas. And now for design and health in Vietnam. The health infrastructure does not meet the needs of health. Number of hospital beds per 10,000 people is at 23.5. It means still low. And distribution of hospital beds is unbalanced between the region. Hospital overcrowding happens in selected central hospital and specialty, cardiology, oncology, trauma, obstetrical is very high while number of beds are low. A technical infrastructure of health facility have been improved, but still not guaranteed technical standard with regards to customized to general hospital, specialized hospital, and clinics. Environmental sanitation, medical waste disposal, etc. Patient needs, especially disabled, elderly, medical worker, working and relaxed space. Vietnam does not have a competent and architecture and experts to design health facility. And Vietnam has large need for building and upgrading hospital facility at different levels. Total estimated investment budget from 2016 to 2020, we estimate about the need about the 7.5 billion US dollar. At the central level, the number of health facility to be upgraded is 60, and the number of health facility to be newly built 8. For local level, mainly to be upgraded. Provincial facility about 200, and district facility 700, and community health station 2,000. We expect a mobilized expertise of global experts to support the vision of an affordable healthcare system for Vietnam, a better understanding of stakeholders, local and health authority, architects and designer, facility managers. With regard to design and health, salutogenic approach, explore and apply salutogenic concept in design of urban, rural infrastructure, appropriate hospital and health facility model. Support the training of designer, architecture with in-depth knowledge on design and health. And now we working with the International Academy Institute to develop the one plan to organize international symposium on design and health in Vietnam 2016. And the goal of this symposium and workshop is to provide a forum for the latest knowledge and information on health infrastructure from around the world to enable benchmarking and the development of tools for planning and evaluation of healthcare facility in Vietnam. Design and Health Vietnam 2016 will explore global salutogenic approach and perspective on the planning, procurement, finance, design, construction, and operation of health facility within the local context of infrastructure development in the region. So here are some pictures. The Professor Alain Delany visited Vietnam last year in one hospital, 40 kilometers far from Hanoi. And also we organized one workshop in Hanoi about design and health. And you know, Ha Long Bay is the very landscape of Vietnam is one of the 7 World Heritage. And here is the Nha Trang. And Phu Quoc is some very beautiful in Vietnam. So welcome to Vietnam. Thank you very much.